Here I am going to discuss about the topic is rhabdovirus. Introduction. Rabies virus causes a rapidly progressive acute infectious disease of central nervous system in humans and animals. It is transmitted from another rabid animal. Although the human cases are few in number, rabies is still considered as a major public health problem because it is almost always fatal. Then move on morphology. Rhabdoviridae family has is a unique morphology. Is a bullet-shaped virus. It has envelope. They have a lipid envelope in which 10 nanometer size in peplomas are there. Peplomas is made up of glycoprotein. Then inner the envelope it is the layer called matrix protein. Then it's also contains nucleocapsid. It contains single-stranded RNA. It is a nucleoprotein and polymerase proteins are present. Is the bullet-shaped virus. It's contain single-stranded RNA, glycoprotein spikes, and matrix are there. Then pathogenesis. Rabies virus is usually transmitted to human by bite of infected animal. However, other modes of transmission have also been rarely reported. In animal bites means in India, dogs are responsible for about 97% of human rabies. It's followed by cat, the mongoose, etc. Rarely bad bite is noticed. Human to human transmission is theoretically possible, but it is extremely rare. In non-bite exposures are rare, such as slick-on abrasions on mucosa, inhalation of viruses containing aerosol generated, then from infected bats, then corneal transplantation, then spread of the virus. Viruses mainly multiply in the start multiply in locally. Viruses start replicating locally at the site of inoculation in muscles or in connective tissue. Viral entry of is a peripheral neurons. Thus, virus bind to nicotinic acetylchloride receptors present at neuromuscular junction. Then it's the neuronal spread. Rabies virus rapidly centripetally along the peripheral nerve modes via retrograde axonal transport. It reaches the dorsal root ganglia of the spinal cord and then ascended upward towards the central nervous system. In the central nervous system is rapidly disseminated to various parts of the central nervous system, mainly in hippocampus and cerebellum. In the centrifugal spread from CNS, the virus spread along the sensory and autonomic nerves to various tissues such as salivary gland, pancreas, kidney, heart, retina, cornea, etc. Then it is shed in saliva. Rabies virus is shed in the saliva of rabid animals, which act as a source of infection to other animals. The viral shedding also occur in human saliva, but human to human transmission has not been confirmed yet. Then clinical manifestation. First, incubation period. The incubation period is prolonged and variable, average being 20 to 90 days, ranges from 1 week to 19 years. It is directly related to the distance of the virus is travel from the site of inoculation to the central nervous system. Hence, the incubation period is usually shorter in children than in adults. Bites of head, neck, and upper limb than legs. Short people, severe laceration, low host immunity. The clinic has been divided into 3 phases: prodromal and acute neurological phase. In prodromal phase, it lasts for 2 to 10 days. It is characterized by non-specific symptoms such as fever, malaise, anorexia, nausea, vomiting, photophobia, sore throat, abnormal sensation around the wound, etc. In acute phase, it is either encephalitic type and paralytic type. Encephalitic type is if it's last for 2 to 7 days, and it is characterized by hyper excitability. It's contain anxiety, agitation, hyperactivity, bizarre behavior, and hallucination may be seen. Then the classical brainstem encephalitis mainly seen in cranial nerve dysfunction, painful spasm of larynx and pharynx is producing shocking and gagging. The patients may death too, mainly in shocking and gagging. The last stage is coma and death. Following it to acute neurological phase, patients develop coma that eventually leads to the death within 14 days due to respiratory arrest. Then laboratory diagnosis. First, to see the in demonstration of Negri bodies, it is used for the staining, cellular staining technique. In Negri bodies, it intracytoplasmic evolution bodies, round or oval shaped structure is eosinophilic with basophils inner granules. It is seen mainly in pyramidal cells of amniotic cell, chromosomes, in Pangat cells of hippocampus, brainstem, and cerebellum. Then demonstration of rabies antigen by direct immunofluorescent test is mainly antemortem demonstration by antigens of saliva, corneal conjunction, skin biopsy from nape of neck, etc. In postmortem, Negri body can be identified from salivary gland, hippocampus, and brain. Then this is the Negri body is a round or intracytoplasmic inclusion is a round or oval shaped structure. Then virus isolation, mouse inoculation. In suckling mice, animal die in 7 to 21 days, may be killed after 5 days, and brain smear stained with fluorescent antibody. Then it is isolated in cell culture by baby hamster, kidney cells, mouse, neuroblastoma, human diploid using fibroblast, chikungunya, etc. Is the prognosis is another name is prophylaxis. Mainly the mortality in rabies is almost 100%. However, it is preventable by administration of post-exposure and pre-exposure prophylaxis. It's a the World Health Organization accepted method. In post-exposure prophylaxis, 3 components are there: local wound treatment, rabies vaccine, and rabies immunoglobulin. In local wound treatment, is a physical cleansing is the first method. If animal is bite wound and scratches should be washed thoroughly with soap and water for 15 minutes. Then chemical inactivation, antiseptic such as iodine alcohol can be used. And then passive immunization. 2 types of immunoglobulins are available. Equine rabies immunoglobulin is animal based, is mainly in horse made serum. Then human rabies immunoglobulin are there. It has no side effect. Nowadays used in human rabies immunoglobulin. The maximum volume of immunoglobulin should be infiltrated into around the bite wound. Remaining volume should be administered deep intramuscular junction. Then active immunization is a rabies vaccine. Rabies vaccines can be categorized into neural and non-neural vaccine. In neural vaccine, examples are Sembil vaccine, beta propiololact vaccine, then cyclic mouse vaccine. These are associated with serious risk of neurological complications, so nowadays not in use. Then non-neural vaccine. The examples of non-neural vaccine is egg-based, egg-derived vaccine, recombinant viral vaccines, and cell culture vaccine. Their most recommended vaccine is cell culture vaccine. 3 vaccines are available: purified chikungunya cell vaccine, purified vero cell vaccine, human diploid cell vaccine. The World Health Organization has classified exposure onto 3 categories. In category 1 is required only wound care. It's not required vaccines and immunoglobulin. In category 2, it's required local wound care and rabies vaccination. Immunoglobulins are not required except for immunodeficiency individual who needed immunoglobulin is addition. In category 3, all 3 components of personal Protective equipments are required, such as local wound care, rabies, and vaccines. In the regimen for post-exposure prophylaxis is mainly intramuscular and intradermal is used. Intramuscular means 5 doses of injections are there. Each is given for 0 day, the third, 7, 14, and 24 days. The day 0 indicate the date of administration of first dose of vaccine and may not be the date of animal bite. In intradermal, means 0.1 ml is recommended. The days are 0, 3, 7, and 28 days. In means of pre-exposure prophylaxis, 3 doses are given: 0, 7, and 21 or 28 days. It's mainly used in the laboratory staff handling the viruses and infected material, clinician, veterinary animal handlers, and travelers, etc. Okay, thank you.